Do you have outpatient surgery or maybe joint replacement surgery in your future? I'll bet you didn't know that there are a number of things you can actually do before your surgery to make things go a lot easier and speed recovery too. David Schell, the Executive Director of Breckenridge Village Not-for-Profit Retirement Community in Willoughby, is here, and Eric Myers, the Director of Therapy at the Fairmount Health and Rehabilitation Center on the campus of Breckenridge Village, are here to jointly tell us how you can achieve a more positive outcome by taking early action. All right.
Nice to be here, Lauren.
Well, welcome again. So, David, let's start with you. It sounds surprising, but, you know, it makes a lot of sense, I guess, if you think about it, that you should prepare for surgery.
Absolutely, Lori. And it's one of the things that is really pretty simple to do and should be on the top of your list. And you can do that by talking to your physician or your orthopedic doctor and ask them about the benefits of having some therapy before you have surgery. And we know that the outcomes are so much better because of that.
Okay, well, Eric, I understand that you're an occupational therapist. So what does this therapy evaluation entail?
That's a good question, Lori. Ideally, a patient should have a physical therapy evaluation approximately 2 to 3 months before they have their joint replacement surgery. The evaluation is performed by a licensed physical therapist. They test multiple areas of patient functioning, including their ability to ambulate, their overall strength, range of motion, and endurance. And once that's occurred, each patient will average approximately 5 or less treatment sessions, which will focus on strength and conditioning through participation in land-based exercise and or aquatic therapy.
Okay, so what are some of the benefits that you see people achieving from that?
Well, once the therapy component is completed, they can participate in an individual exercise program that they'll be prescribed to complete up until the actual surgery. And ironically, the exercises that the patient participates in before and after their replacement are very similar, if not the same, so they get a good experience.
So if you do it beforehand, though, you're getting your joints ready to go and familiar with the exercises, and what does that mean for the patients in the big picture?
Well, there's several benefits to participating in exercise before joint replacement surgery. Many studies show that men and women who participate in exercise before the surgery are able to walk 50 feet or greater during the early postoperative period.
They do a lot better than the people who haven't had it yet.
And exercise was also an indicator of who could return home sooner.
Okay.
For example, one research study showed that 65% of those who exercised were able to go home from the acute care hospital versus those who didn't exercise. Only 44% were able to return home, while the remaining 56% had to go to rehab in an alternate facility.
Okay, so you really want to do this therapy. Yeah. So David, it sounds like preparing for the surgery ahead of time gives you a jump start.
Absolutely, and you can kind of see from, I think there's a graphic that's up that talks about all of the choices that may be presented to someone, either coming out of the hospital and going into an inpatient rehab, receiving home health care like through our Senior Independence, or outpatient aquatic or land-based therapy. All of this therapy is done one-on-one, and it's really tailored to the individual. So Eric and his staff are a great crew, and they're tailoring the program to the person. And it's available to not only our residents, but those out in the greater community.
Okay, that's fantastic. You've got some exciting more news about what Breckenridge Village is going to be doing, right?
Yes, we're absolutely thrilled. And this month we're opening up the new Nelrose Real Rehabilitation Center at the Fairmount Health Center, and it's state-of-the-art inpatient rehab rooms. You can also see pictures here of our Veal Wellness Center, where we do our outpatient aquatic therapy and land-based therapy. And then there's also Senior Independence, our home health arm. And so we're so grateful to the donors that have helped us with these buildings and some great facilities on the campus.
All right, they look beautiful.
Thank you.
So if you have surgery on your schedule and you want to start preparing now, give Eric and Breckenridge Village a call at the number that's coming up next. And you can receive a free guide to outpatient therapy options at Breckenridge Village. My thanks to David Schell and Eric Myers for some sound advice about pre-surgery therapy options.
Find out more by calling Breckenridge Village or visit their website, www.breckenridgeohio.org. Next, legal news you can use.